Good evening. Hi, my name is Mayor Donald Shaw, and I'm the mayor of the great borough of Roselle. And on behalf of the borough, I want to thank all of you for joining us in on this very important conversation about the role we as men play in addressing the Black maternal health crisis. Thank you to the Partnership for Maternal Child Health of Northern New Jersey for organizing this virtual event. Also want to thank our esteemed panelists, Dr. Jinadu, Newark Councilman Larry Crump, and East Orange Councilman Chris Arway, for coming on to share your knowledge and perspective. I really appreciate you guys for allowing us to host this, and then I know this conversation will indeed be very fruitful. Again, thank you guys for putting this together, and just for the record, Missy, you do keep us all in line. So again, thank you guys, and please have a safe and happy holidays.
Hi. Good evening, everyone. My name is Marie Kinsella. I am the Director of Community Programs here at the Partnership for Maternal and Child Health of Northern New Jersey. And as the mayor just stated, this is a very important event. I'm so happy that, we have these esteemed speakers, males who are really interested in, changing the paradigm when it comes to maternal and child health. We're including the fathers, as we probably should have always done, but we haven't. So for those of you who don't know, there is a maternal health crisis in New Jersey. We know that 7 Black women die 7 times more than white women when it comes to pregnancy-related complications. And I saw a couple of people like raise their eyebrows to say, yes, it's an awful statistic, but we can turn this around. And we do that. The partnership is providing education and information around this important topic so that we can become informed and really support our birthing individuals in the state of New Jersey. Again, I've been in this work for 30 years, and my heart is really lifted by the support that I'm seeing, this last year, especially. I've seen interest come and go, but I feel now that this is something that we're really going to focus on. We're going to make some changes. The partnership is doing so many different things that can really help move the needle. We have doulas, we have postpartum doulas. We provide information and education, and that's why all of you are here tonight. So we know that by being informed, that is going to support our mission in terms of making sure that the community of New Jersey knows what's happening as it relates to maternal and child health. So I could go on and on, but I'm not. We are here to really listen to our speakers, our panelists, as well as get some information on maternal and child health and the crisis, not just in New Jersey, but across the state of New Jersey. But across the United States. So thank you.
So good evening, everyone. Thank you for joining us today to have this very important discussion. My name is Jerry Balmer, and I'll be introducing the panelists, the esteemed panelists. We have a great group of men here that are concerned, that have been active on this issue. So I'm looking forward to the discussion. But in the introduction, I do want to make sure I go through the bios of each of these men to let you know what they do, their specialty, and where their passion lies. So I'll start with Dr. Jinadu, who is a board-certified obstetrician gynecologist. As a member of the women's health community, his primary focus is providing high-quality, comprehensive care, and he's fiercely dedicated to caring for all women, helping expanding families, and being a supportive resource. He is also committed to patient education and empowerment. He serves as an advisory board member of Selene, so I'm sure I'm getting that wrong, but he'll correct this later, maternal mental health and education company whose mission is to support the mental health of mothers and all birthing people during pregnancy, loss, postpartum, and beyond. Through his work with Selene, he has helped develop a provider course on how to deliver bad news in a healthcare setting. After graduating from Oakwood College, now Oakwood University, he went on to earn his medical degree from NYIT College of Osteopathic Medicine. He completed his obstetrics and gynecological residency at Robert Wood Johnson Barnabas Health, Jersey City Medical Center. He prides himself in providing high quality care in both New York and New Jersey. He's affiliated with both major academic teaching institutions and community hospitals alike. In addition, Dr. Jinadu provides care through his concierge medical practice, curated care. And we also should say that he is currently on call, so bear with him if he has to drop off while he's blessed us with his time this evening. The next person I want to talk about is a personal friend and a strong advocate on many issues in the community is Councilman Crump out of Newark, who was sworn in as Councilman at Large in August 2021. He was extremely honored to fill the position vacated by Council President Mildred Crump. She dedicated her life to serving the residents of the great city of Newark. On May 10th, 2022, Councilman Crump was elected to a full 4-year term by the residents of Newark and sworn in on July 1, 2022. C. Lawrence Crump, Esquire, is also the General Counsel and Director of Development for the Newark Parking Authority. In this position, Mr. Crump provides all necessary expert legal services for the Parking Authority, including working closely with the Executive Director on the construction of a $35 million mixed-use parking facility. Mr. Crump formerly served as the liaison legislative director of the Department of Economic and Housing Development for the city of Newark. In that capacity, Mr. Crump worked on every piece of legislation, on other legal documents in furtherance of the city of Newark's overall economic development strategy. He previously worked as the first assistant corporation counsel for the city of Newark Law Department and as chief of staff to the city of Newark Council President Mildred Crump. In that capacity, he provided advice and counsel to the councilwoman, acted as a liaison between the councilwoman and all department directors, including the mayor's chief of staff, business administrator, corporation counsel, and director of economic development, managed all office activities and staff members, and reviewed and drafted legislation before the city council. Prior to being chief of staff, Mr. Crump was of counsel to Cooper Levinson, April Nettleman, and Wegenheim, PA, from August 2006 to February 2011, where he managed their Newark office. There he demonstrated his expertise in real estate and land use by representing a variety of clients, including individuals, investors, not-for-profit, for-profit developers, and governmental agencies, by making frequent appearances before the planning board, board of adjustments, and governing bodies, ranging from small to multi-million-dollar development projects. Mr. Crump also has an extensive experience drafting, reviewing, and negotiating contracts, leases, redevelopment agreements, memorandum of understandings, etc. Mr. Crump also serves as a judicial law clerk for Honorable F. Michael Giles, who's retired. Mr. Crump is very involved in the civic community activities, including member of Alpha Phi Alpha Fraternity, Board of Newark, Newark Symphony Hall, Prince Hall Mason, Tyree Lodge 29, Fellow Leadership Newark, Inaugural Class 2000, founder and former Board of Directors, University Heights Charter School, Newark, and proud member of Bethany Baptist Church in Newark. Mr. Crump received his Juris Doctorate in 1998 from Rutgers University School of Law, Newark, New Jersey, and his BA in 1991 cum laude with a major in banking and finance from Morehouse College, Atlanta, Georgia. He's admitted to practice law in New Jersey. Larry, as I know him, is happily married to Zelma and his 2 wonderful children, Margaret and Cecil. 2 more to go, y'all. Just bear with us. I want you all to hear who these folks are. Next up, we have Councilman Awe out of East Orange. He was elected by the East Orange City Council to fill a vacancy in the 2nd Ward caused by the resignation of Councilman Roman Bullock and sworn into office on Monday, July 2nd, 2018. He was elected at the Tuesday, November 8th, 2018 general election to fill the unexpired term of Councilman Roman Bullock. Councilman Awe is the 2020 chairman of Finance Committee and has also chaired the Planning and Grants Committee. He has served as a member of the Arts, Recreation, and Cultural Affairs Business Committee. Councilman Awe is a life resident of the city of East Orange. He has served on several campaign committees in the city and has been a member of the East Orange Democratic Committee for several years. He served as a 2nd Ward chairman for 8 years. Councilman Awe is an active member of Phi Beta Sigma Fraternity Incorporated, the International Free and Accepted Mason, and the Urban League of Essex County. Councilman Awe is a first-generation Nigerian American, a co-founder and principal of Unlock Africa LLC, a social enterprise which supports small and medium-sized businesses with the essential resource to evolve into sustainable and successful business ventures. Councilman Awe is a graduate of the University of Maryland Eastern Shore. And last but not least, I'm so excited to introduce Kevin Cox, who's in the trenches, runs the Fellows Program, and he'll tell you so much about this. And he's going to moderate the panel today. And Kevin Cox has been working with children, teenagers, and families in the Essex County, New Jersey area for over 15 years in various capacities, ranging from academic environments to residential and community settings. Mr. Cox is an Essex County native and a proud product of a single-parent Caribbean household. He is also a graduate of St. Benedict's Preparatory High School in Newark, New Jersey. Kevin holds a master's degree in Arts and American Studies with a concentration in urban systems from Rutgers University. His undergrad degree was in English, also obtained at Rutgers University. He currently serves as a program manager for the Fellows Fatherhood Program under the hub of the Partnership for Maternal Child Health of Northern New Jersey. Fellows services Essex County fathers seeking assistance. In addition to his work with Fellows, Mr. Cox is also an adjunct professor at Essex County College, teaching courses in African American history, world civilization, and U.S. history. Kevin's professional life work has been intertwined between direct social services and education to lead youth and underprivileged families to higher heights of performance and self-sufficiency. He's accomplished this through mentoring, teaching, and social advocacy as a way of harvesting tomorrow's leaders in our communities, teaching them to overcome yesterday's difficulties by firmly grasping their present and future. So that right there rounds up who our panelists are going to be today. I'm excited to hear what they have to talk about. And with that, I'm going to hand it over to Kevin Cox to moderate this panel. And again, thank you everybody for joining this evening. We're going to do the panel, and at the end of the panel, we'll take some Q&As. So if you have questions, please drop them in the chat, and we'll start to go through them once the panel is concluded. Thank you so much.
Well, thank you for that introduction, Jerry, and thank you guys for joining us. As Jerry mentioned, I am Kevin Cox. I'm the program manager for the Fellows Fatherhood Program, which is a hybrid program for fathers in Essex County that's sponsored by the Partnership for Maternal Child Health of Northern New Jersey. Just for those of you who don't know about Fellows, just to catch you up briefly, we're a group of guys that get together and discuss fatherhood topics that's centered around improving parenting skills, improving communication, and becoming and/or improving the ability to be economically stable providers. Coming through our program, we hope to produce a slew of great fathers and positive community contributors. We have a great team of fatherhood program specialists, some of them who have joined us on the call today. And we operate, as mentioned, here in Essex County, but we're really looking to expand into other areas. We're concluding our current cohort that ends in January, and we'll be recruiting the whole month of February for the start of our new cohort in March. So we could really utilize any help that you guys could provide in sending us referrals or new fathers or men that are interested in the program. But again, moving to our esteemed panel and such a great topic at hand that we feel everyone should be informed on, I'd like to start with Dr. Jinadu, especially just because we know he's on call and we don't want to take up and delay too much of his time. But Dr. Jinadu, I really wanted to start off by asking, what made you want to become an OBGYN?
Thank you for that question, and I'm really happy to be here. I think what you're doing, Kevin, is a really important program. The program that you administrate is a really important and needed program. So I'll be brief. You know, interest in obstetrics really lies with the fact that usually it's the happy part of the hospital. And, that's kind of a stock answer, from an OBGYN, but when you're bringing new life into the world, and you see the joy, the genuine, the joy in mothers and fathers' faces, grandparents, everybody is happy for that baby to arrive. And the anticipation is high. And so it's always, it sounds like some kind of sporting event most of the time, when you have that birth. So that was a big deal for me, being is that in medicine, there's so many things that just aren't a happy time, and I'm not saying that there's always happy times in obstetrics and gynecology, but for the whole, I knew that at least in this area, there's always going to be, an event happening. So that was a big deal for me. And then beyond that, I'd meet patients in the inpatient, outpatient setting, from the very, the young all the way to our, grandmothers. And women take care of themselves, fellas. So they go to the doctor, which is a novel idea of just when you have something going on, just talk to one of us. It's great. And so that also helps. When you feel like you really can make an impact in life. And oftentimes our wives and mothers are the doorway to healthcare for the whole family. So it's not uncommon for mom or sister or wife to talk about something that's going on with their husband, and I'm able to steer them in the right direction so that they can talk to, a physician and really resolve an issue that they may have been ignoring. And so usually the wife or mother, the woman in the house is somebody that is the really the door to open healthcare to the rest of the family. So those are a couple of reasons why I ended up going into this specialty.
Thank you. I mean, we definitely see that in our program as well, in terms of mothers and wives and women just kind of being the gateway for fathers exploring their own health. So that's something that we're trying to encourage on one hand, but we also are trying to encourage our fathers to become more familiar with their doctors and get comfortable in that atmosphere for themselves. But you are a physician, you're also a father. So how did you support your wife during her pregnancy?
Well, it really was just that word, which is support. There's I like to make the joke, and my wife will always roll her eyes at me when I say that my medical degree stops at the door. When I'm at home, it doesn't matter what's going on. It could be like a fastball. I hate to use sports analogies here, but I will. It's gonna be a fastball right down, the lane, right in obstetrics and gynecology, and I'm like, I know this is my thing, but it doesn't matter, and really what I took from that is it's not so much what I know, it's more about my response emotionally in connection with my wife. And so as a father, that's what you really have to give to your wife or in my view, what you need to give to your wife really is just your listening ear at times. And that's most of the time what it really is. Just you want to support that this emotional time during pregnancy, when aches and pains may not just be aches and pains. They could be anxiety or worry about being a good mother, or being prepared for the new baby, or being prepared for the life changes that a baby brings, that are particularly different than all other types of changes for women. And so really it's slowing down and offering the emotional side that sometimes has been, cemented over as men, and we can really, need to soften our minds and our hearts so that we can be there for our wives and mothers that are or mothers to be.
Absolutely. I know a lot of our fathers, especially the younger ones, are often worried when they're entering the delivery room. How has the perspective of being a worried father during delivery kind of changed your perspective as a physician?
Well, I always like to tell patients that when I go to, if I ever get a ticket, I have to go to traffic court, right? That's not my arena. I'm a fish out of water. I have no idea what's going on, and I don't know the players. I don't know the moves. And so I feel very uncomfortable. And so likewise, when you're in the hospital setting, especially on labor and delivery, where there's a lot going on that you can see and a lot going on that you can't see, all you see are things that you don't fully understand right off the bat. And so I think that the first thing I do is, and maybe this is a little bit off of the question, but from what I see from patients, my method really is to let them know that just what I said. I understand that this can be uncomfortable because I know what's going on and you may not necessarily understand everything, but I'm going to be there for you and I'm going to explain everything that we're doing, introduce everybody so that you know people's names, so that you feel comfortable speaking to them, because we're all people taking care of other people. It's not necessary. Yes, I am a doctor, right? You do have nurses, but we go home every night, right? And so when we're there taking care of you, I'm taking care of you not because it's my job, but because I care. And so if there's something that you don't understand, it's best to ask in plain language and expect a plain language answer. If you don't understand, don't be afraid to say, hey, I don't understand, and just be, and ask for further explanation. And so as a father, it kind of takes the worry away when I feel empowered to ask those questions and don't feel like I'm bothering somebody or I'm getting in somebody's way. So I would say that that's probably the biggest way to dispel some of that anxiety, just being open and honest and saying, this is not my arena and I have a lot of questions,
Well, Doc, we wish a lot of other doctors kind of took your approach when it came to sharing that kind of info and being as caring with the family. At times it could be intimidating, if you feel that you don't understand or you even might have to challenge a physician or another healthcare provider during a crisis situation. So how can we as men be a strong advocate while also not being painted as angry or difficult?
I love this question. And what I thought about when I thought about how to answer that question is I would like to change the word from challenge to converse. And I think it may feel like a challenge, right? But I think that the reason why it feels like that is, again, because you're uncomfortable. You feel defensive because you don't know exactly what's going on. When you come on labor and delivery, even me as a male OBGYN, I tell patients I'm outnumbered already, right? I work with all women, and I don't, and I'm happy to, but I don't overestimate my position as the role of physician, and so you approach things with humility. And as a father, when you have a concern, it's perfectly fine to raise that concern, and no one is going to consider you to be angry or upset. Again, it's about the patient first and really being patient focused. So while things may be happening quickly in an emergency situation, an explanation is still owed. It may be on the fly, and you may not understand everything all at once, because things on labor and delivery can happen very quickly. And I mean, 90 seconds or less, things can change very quickly after things looked like they were going just fine. And so I think it also stands to state that, when you have a good working relationship initially with your physician, there's a trust that's built. And so when things do change quickly, I think there is a little bit less of a shock when that would happen. And maybe everyone's defensiveness can be melted away, and questions can be asked and explanations can be given on the fly. But it's even longer answer than that, I'd say. But I think really just communicating and being open to, as a physician, being open to questions and explaining as much as you can while you're taking action. So you talk and work at the same time,
Okay. Thank you. I mean, just to quickly take things out of the doctor's office for a second, we know that pregnancy and new parenthood bring a lot of life changes for the entire family. You're bringing a new person into the world, and it's a beautiful experience, but it could also be terrifying for the mom and for the dad. What are some signs as a father to look for during the postpartum phase that could be red flags?
Well, I would say the first thing I would do is always be in communication with the new mom. And what I mean by that is, emotionally, a lot of the weight of being a new mom is silent. If you're as a father, my own experience, if let's say you're breastfeeding, which is a beautiful and necessary thing for a new mom, it might be in the middle of the night when you're asleep and she may not wake you up. She could be having a tough time, and I sleep like a rock. So if my wife isn't going to wake me up necessarily all the time, and she might be having a rough time and doing it silently. If mom is on maternity leave and you're at work and there's a lot going on at home and you have no idea, then all those can be times where you're not able to assess what's going on with a new mom mentally. So checking in is a big thing. Just a phone call if you're not there, and just how are you feeling? An open-ended question, and just listening more than talking, just to kind of understand where mom is mentally, because postpartum depression is a more prevalent occurrence than we might think. And it's the little things that allude to larger issues that a mom might need support with. And you might be the first person to identify that. And so that's one of the red flags. So just when a mom is saying, I'm really struggling today, or I don't want to talk about it, or is teary-eyed for what you might assume is a small occurrence like spilled milk, those are things that you really should be paying attention to. On the more on the more physical sign type of side, severe pain, fever, heavy vaginal bleeding, things that really after delivery shouldn't be that pronounced. Those are all reasons to alert somebody that something might be wrong. So all of those things can be commonly assessed at home and don't necessarily need a medical degree to really evaluate.
Okay. Well, thank you, Doc. I mean, we do have some more important questions for you, but I would like to get our councilman involved. So let's start with Councilman Awe. I want to thank both of you, both Councilman Crump and Awe, for your work with the partnership as health ambassadors. You both served as ambassadors for the Hear Her campaign, which highlighted the warning signs of pregnancy complications. Why is this cause important to you? Let's start with Councilman Awe.
Well, thanks for having me. It's great to be amongst these great gentlemen and all that's watching. You know, it's been a great year as an ambassador, and I've been excited. And, you know, we know that conversations like this are impactful. And so for me, why it's so important, it is quite simple. You know, our queens, our sisters, our mothers, our aunties, they're the lifeline of our community. And not only are they the lifeline of our community, they're the lifeline of the success of our community. And so anywhere where we can be an asset, we can support that. And obviously their mortality and their health is paramount, in particular when you're bringing in more life into the world. And so whether you are a father, or uncle, a brother, you know, whether you have kids or you don't, this is a issue that has incremental impact onto our community. And, you know, as we see, a lot of people don't know how impactful the effects of the lack of knowledge, the lack of advocacy they have for our sisters and our mothers in the community. And so if anything we can do to amplify that message, I'm here. We're all here for it. And it's been, you know, quite a worthwhile opportunity for myself and, you know, my colleague there to go out and spread the word to increase that advocacy.
And we sincerely thank you for spreading the word about that. Councilman Crump, why is it important for you?
Yeah, thank you, Kevin. And thank you, Maternal Partnership for Maternal and Child Health, and everyone involved. I appreciate the fact that they asked me to be a Hear Her ambassador, because like my council colleague was saying, you know, the women who are pregnant out there are our mothers, our sisters, our wives, our daughters, aunties, everyone. And so if we don't take care of them, who will at the end of the day? We are responsible for our own village. We are the ones who need to take care of our families. And I want my children, not my children, but the women in my life to be treated a certain way. And based upon that, I'm going to want others to treat them a certain way. And I want to treat other women in my community a certain way, a way that respects them, a way that we acknowledge the beauty of childbirth, the beauty of pregnancy, the beauty of bringing life, you know, something we will never, ever be able to do. But, you know, it's just critical that the men out there are involved. And not just involved in terms of it's my wife, it's my girlfriend, it's my daughter, but involved in the community to say, you know what, we have a neighbor who lives down the street. You know, she's just like she's having a tough pregnancy. What can we do to help? You know, let's talk to her. Do you need me to go to the grocery store for you? You know, do you need me to help get your medicine if you need it? What do you need? How can we help you? Because unfortunately, I think in society today, too much negativity is out there. Way too much negativity. And I think things like being a Hear Her ambassador, we have a platform in which we can say the negativity needs to stop, but we need to be positive and act in a positive manner in supporting our women in our community. Because like Councilman always said, they are our backbone for the community. You know, look, if I didn't have a wife, I don't know where I'd be, to be quite honest. And she'll tell you that too.
Absolutely.
So it's a beautiful thing to be a Hear Her ambassador, and I'm proud to continue to do that as long as they ask me to.
Well, we're glad to have you both as Hear Her ambassadors. But even as Hear Her ambassadors, or just as Black and minority men, how can we advocate to ensure that our women have the best maternal care?
So I think, as the doctor said earlier, the first part is listening, and looking out for the signs. A lot of times we, as the partners, as the brothers, or whatever the case may be, we usually have the eye of the first signs of any situation that may arise, whether it's physically or whether it's emotionally or otherwise. And so us paying attention, right, and making sure we're keen on our ladies, our women, our queens, our sisters, and our mothers. And, you know, when things aren't right, oftentimes we're the biggest voice too, right, in terms of amplifying that message. And so it may take that conversation with Dr. Jinadu, like, hey, doctor, let me take you to the side as, you know, man to man, as brother, like, listen, so things ain't seeming right. And that takes us going to the doctor's visit, and that takes us actually being a part of it. For me, you know, just on a personal note, I'm not yet a father. So, you know, and I'm glad that I have all of these, you know, older brothers to look to right? When that time comes for me, that I can get that advice and get that counsel. And that may be a way that we can be an advocate too, making sure that we're supportive to each of our brothers that is also going through it and having those conversations too. But one situation that was pertinent for me is, I was a teacher. And so when one of my students are pregnant, right? And just being keen on her and, her behavioral, changes and so on and so forth, and just being able to say, is everything okay? And being able to be an opportunity for them to vent or talk about whatever issues they have, and then being able to pull whatever resources together. I think those are the ways, the subtle ways, right? Obviously we have these ways where it's more overt and we're actually got the megaphone out and we're putting that message out there. But the subtle ways is where I think we can make the impact, and the subtle ways is what we do within our own households, within our own families, within our own, intermediate networks, and making sure that we make us, avail ourselves and actually hearing her, right? And that's why I love the name of the campaign, the Hear Her campaign.
Exactly. Very well put. Councilman Crump, how do you feel?
Yeah, I pretty much ditto what the councilman said, right? Spot on. I think it's important that we communicate with each other. Let's not be afraid to have that conversation with our friends, with our brothers, family members, or just people that we know. Every time I talk about it, I get a positive experience. It's positive. People, when we talk statistics, they're like, wow. When we talk about, being there for, a pregnant woman in your family or in your neighborhood, they're like, you know what? Yeah. Because, some of them are like, I used to help grandma walk across the street, back in the day and things like that. But now things are different. Let's help grandma as well as cousin, auntie, everyone else. And as I said, I think it's important that we discuss it amongst each other. I just had a conversation actually this morning with a gentleman who a good friend of mine, and I was telling him I was on this panel, and he was telling me about his wife's pregnancy, which was a very difficult one, in which she was very depressed, and what he had to go through, and to support her, and he was there to support her, and not necessarily what he had to go to, but what she had to go to, and the fact that he was there to support her was very important. And I had no idea about this part of it, and he and I had a good and frank conversation about that. And I think we need to have more of those. I think panels like this will help us get there. The more we communicate, the more folks will know what's going on, and the more we can get folks involved in doing the right thing for our pregnant wives and family members and friends.
Well, thank you. I mean, we're all going to try to continue to have those conversations and to really push them. Don't run off, gentlemen. We have some more questions for you, but I think one of the more important questions of the night we got to redirect towards Dr. Jinadu, which is, as men who are interested in advocating and men who are interested in petitioning for better health care for their wives, for their women and their partners, what steps are being taken by physicians and healthcare systems to improve maternal health outcomes among Black women?
Man, also another great question. Before I answer that question, I wanted to just make a comment about what the councilman said, which is when you're the father or the male caregiver, right, in the relationship, and you're recognizing something and you're struggling to understand your own emotional state and how to care for your wife or your baby mama or whoever it is, right? It's important to reach out to other people that have gone through this. And I think as males, we don't necessarily pay enough attention to that, or we may be embarrassed to ask those questions, even if it's to our good friends, because, a lot of times we don't want to be seen as not able to handle what is going on in our own household, which couldn't be further from the truth. Everybody needs help at some point. And so I think I just wanted to reiterate what the councilman said and just add that it's okay and it's best that you reach out to somebody, because if you can't help, then you're going to be of no help. I'm probably a rhetorical statement, but if you can't help, then you're both are going to suffer, in other words. So I just wanted to mention that. And can you repeat that last part of the question? Sorry, the long train of thought that I've been working on.
Sure, no problem. We just wanted to know what steps are being taken by healthcare systems and other physicians like yourself to try to improve the maternal health outcomes among Black women.
There is a focus, and I can say this as somebody that is in multiple labor and deliveries across New Jersey and even into New York. Behind the scenes, and not necessarily in front of the scene or in the scene, is a real focus on the statistics of Black maternal health. The conversations really are happening as to asking the question, why and what can we do? Their systems are going to act on the system level, and the systems that they put in place are going to focus on Black maternal health, but also what good obstetrical care can provide for Black mothers. So things like looking at inductions, looking at interventions during labor, and even before we get to labor and delivery, in the outpatient setting, how much time we allot for things like prenatal visits and getting those questions out, time for evaluation, and really considering the unique situations for each patient. In our community, we can't always just take a day off of work, and so making it to prenatal visits, it's not just a given, but on the physician side, looking at a patient and saying, instead of looking at it like, why weren't you at your prenatal visit, kind of in a negative way, really asking, how can we help you make it to your prenatal visit? Or how can we tailor your prenatal visits or change the schedule of your prenatal visits to more suit what's going on with your life? Because you might be the primary caregiver, have 2 other children, and it's not just a given that you can take 4 hours out of your day and go from travel time to waiting time to whatever else in between with your prenatal care visit. So yes, the conversations are happening at the system level, meaning the corporate level, and also talking about the systems of delivery for prenatal care and interpartum care, with a particular focus on African American health.
Okay. Well, thank you, Doc. Our next question for Councilman.
Kevin, I hate to ask, if I could jump in real quick, just to,
Sure.
What the doctor was saying is so appropriate and so true. I could tell you, when my wife was pregnant with my son, it was the most exciting time in my life, but also the most frightening time in my life, from day one until the birth of my son. And I couldn't show that, the frightening part of it. But I made sure that my wife, or at least I hope I made sure that my wife felt secure. And I actually went to every one of her appointments. I made the time and figured out my schedule to make sure that I made every one of her appointments. And I think that made a big difference in her comfort level, which, in turn helped me with my comfort level, even though that wasn't the purpose of it. So, if you know enough in advance and you can make that time, I would highly recommend that you try to get to the appointments. Plus, I was able to ask questions. I was able to see what was going on and really understand things. When and not just sit in the waiting room, but actually go into the with the doctor and ask those questions and see what's going on and understand. And I think that helps both parents in situations like that, in terms of comfort and leaning on each other and working together and if necessary, double teaming the doctor with questions,
Well, along those same lines, this is kind of a question that we come up with a lot in fellas. what's one piece of advice that you would give to a new father or father to be, given your experience?
Are you asking me or
I'm sorry, Councilman Crump.
Okay. The biggest the advice that I would say is you don't know everything, and don't be afraid to ask someone. I mean, I look, all my friends that had kids. I'm an old man with young kids. That's what happened with me. So most of my friends have older kids, or say they went through it prior, and I can't even tell you how nervous I was with my son. I mean, I go in his crib and I'm like, is he breathing? Is he breathing? Like my wife would be like, stop, he's fine. But what helped me get through that, because 90% of it is me trying to support my wife. But what helped me personally get through it is talking to my boys who had kids and saying, and they'd say, you know what, I did the same thing. Or you know what, this happened that way, that happened that way. And it helped me tremendously get through it. So that's the biggest advice I would say. Just talk to folks. Talk, know it all. We think we know it all. We don't know it all. And talk to those who have had the experience. You also learn what not to do too, because I can tell you, people ask me questions sometimes, and I'm like, I did this, and that was not the move. Let me tell you. So it helps one way or the other, I think, and that's the biggest advice I would give.
Kevin, I got one question for Dr. Jinadu that's really specific and medically related. So someone asked, what things should the father expect or need to do as our wives are entering the third trimester?
Well, the third trimester, I like to say, is like that the long stretch. It is the hardest trimester because you're wrapping things up. A lot of things are going on with mom. Like one of the big things is a nesting complex. I won't call it complex, but a nesting feeling. And that's really making sure that you have what you need for the baby. And it's well studied. It's almost textbook. It's not something that's a myth. It's, a feeling of, for a lot of women, that can be anxiety producing, because it's like, we don't have everything that we need. And so really helping things like this is when you put together your crib, getting your nursery ready, making sure that you have things like diapers, and enough of those, and onesies and wet wipes, and all of the different things, organization, making sure that when you come home from the hospital, things are clean and you're ready. Some patients don't get the luxury of being able to prepare for that. And so there is a little bit of anxiety that can be produced because of this, during the third trimester. So that's the one thing, is understanding how to support mom through that nesting complex, helping her organize, really being involved in that part of the pregnancy. Also, things that the aches and pains of pregnancy tend to become even greater because baby's starting to take on a lot of weight. Physiologically and anatomically, your body is changing. Your spine is being pulled forward, so therefore you might have a lot more back pain. Your fatigue is at an all-time high, and so at this point, moms are looking to slow down and also need extra support, and I mean physical support. Looking for things like a belly support band is something that I always recommend to try and help correct that. We call it lordosis, which is the outward curvature of the spine right around the abdomen. If you can imagine that the baby's pushing your uterus forward and it's pulling your back forward. Commonly, you'll see moms with both their hands on the small of their back. And for that matter, having something like a bouncing ball that you can press your fists or your hands into the small of your wife's back, or your thumbs into the small of your wife's back, that helps with that low back pain. Going on long walks with your wife, not just to build relationship building with your wife, but also to help keep mom active, so that when you do end up going into labor, has been shown that active moms have less aches and pains during pregnancy, but also it helps with, with labor, not going into labor, but laboring. So that third trimester really is the end of the marathon. And so just a little, more intensive focus on your wife and supporting her through just those small things can really have a large impact.
Right. Now, this is just to jump in real quick. We do have these gentlemen till 7 o'clock, and we have 7 minutes left. And as you see, this is a robust conversation that we could have all night. And I don't want to put anybody on the spot, but this is so important. We might have to make this a series, because I think we got something going here in terms of providing a safe space where men can ask questions and be honest with the struggles that they're having, if they're father figures or whatever is going on. So with that said, and Kevin included, I'd like to give everyone some final words to say. And why don't we start with Kevin, man? Because I mean, you're holding us down as an anchor and you're a part of a program. So I'd love for you to give us some final words. We can go with the councilman and then have the doctor close us out.
Well, again, I thank everybody just for joining the conversation. It's an important conversation to have, one that we at Fellas and at the partnership through our family success centers and all of our different programs intend to further. Again, excuse me, I just want to thank everyone for their participation. I also want to remind everyone again to check out the partnership and all of our different programs. Of course, I speak extensively about Fellas, but they have a multitude and a plethora of programs for mothers, for children and families. So again, we're just looking to impact our communities even more and just familiarize everyone with the partnership. But thank you all for joining. And please look out for the Fellas Fatherhood Program. We'll be looking for new members again in the month of February. Thank you.
And but before I let Councilman Awe go, if you check the chat, the partnership's website is on there. So definitely check that website out and you can see the great list of community programs that they're administering. So Councilman Awe.
Yeah, again, I'm so grateful to the partnership of Maternal and Child Health and their great staff and this opportunity we have here. I mean, this one, and Councilman said it earlier, this is something everyone can get behind easily, right? There's no conflict in, this one, no matter socioeconomic status, age, this is something that all of us men should be definitely directly engaged. Even if you're childless, if you have a plethora, this is something we all need to get behind. And we spoke for all of the reasons. And, for me, personally, it takes a personal note for me. My mom was a nursing professional for 50 plus years, started off as a midwife. And, I'm the godfather of 5. Right. So I'm like the quintessential uncle. Right. Wow. And I'm looking forward to my time. And, this is conversations like this that may not have been around before. And it's interesting. We didn't have things like this around before, but look at the numbers. They say numbers don't lie. And you look at how staggering the numbers for our women in our community, it just shouldn't be. With all of the technological advances and for all of the avenues that we have, it just should not be. And so it takes these conversations to start. I'm so thankful for, again, the partnership to give this opportunity. Y'all have me as long as you need me. I would love to be still an ambassador and have my children and be able to say that the, Fellas program and all the programs actually helped me personally. Like I said, all of the big bros that I have here to get the advice from, and there's so many different ways, no matter where you at in the community, where you can have positive impact in this issue here. You don't need to be a legislator. You don't need to be a doctor. You don't need to be, a program administrator or a director. You just being a man can make the impact. And it can be, your daughter, it can be your sister, it can be the woman across the street. And it can start off with, are you good, sis? Do you need anything from me? Do you need a ride? Or anything to that extent? And you're already making an impact. And so I will continue to, amplify the message as loud as I can and spread the network, even larger. And, I'm just thankful for the opportunity. And so again, I'm just glad that we have everyone here listening. Kevin, great job. Of course, Jerry, bro, you already know, and Missy and all the partnership staff. Thank you for the opportunity, and I look forward to just again expanding the program and going not just locally in our community, but statewide and nationally speaking to really make the difference because it's important.
Councilman Crump.
First, let me thank the partnership and the fellows for what you do. It's important. We have organizations in our community that are there, that are advocating for our women, are advocating for our men, are advocating for our community. It's essential that we support those organizations that do those things. But let me just say this, I think with regards to being a caregiver or being in the life of someone who is a woman who is pregnant, support them, support them, support them. I can tell you as a father, when my wife was pregnant, I read, and I read a book, this is 10 years ago, What to Expect When You're Expecting. I'm sure you know that book, Dr. Jinadu. But it helped me. It helped me tremendously. It may not have been, and I don't know if it is completely accurate, but it helped me at least through some of the trials and tribulations that I was going through, and dealing with my wife, and dealing with, like the doctor was saying, with her back pain, and we had the belly belt and everything, and read and also talk to people. Talk to your friends, talk to your family, find out what's going on. Find out how you can help them. Find out how you can help your neighborhood. Get involved. Get involved. This is something that I look forward to doing over and over and over and over again if needed. And I will continue to do that and bring other people on board, because I think Marie said it, talking about information. I think information is power. And the more we provide information to the men in our communities, the better our women in our communities will be. And so I just want to thank you again. I got to thank Jerry, who I've known for way too long, and Missy, who I've known for way too long, for inviting me to be a Hear Her ambassador. I appreciate you for including me in this. And I hope that, going forward, we can continue to do more of this. And I'm always open and always be there for this. Thank you.
Dr. Jinadu.
Thanks for having me, guys. I think this was wonderful. I think the dialogue is so necessary. And I think the perspectives from someone that doesn't have children, but is very closely associated with healthcare in terms of having family members, to fathers that are, quote unquote older, that, that's all right. We all have some gray, coming in, except for the young guy up there in the right-hand side. Anyway, it's really necessary to know that there are other men, Black men out there that are there to support you wherever you are in your journey of fatherhood. And so keep the program is amazing, and I'm happy that I was brought in for the conversation, and I look forward to the next conversation.
So just a couple things. If you look in the chat, the information is for the documentary you saw, Aftershock. It's on Hulu, so you can check it there. There's information for Kevin Cox and his colleagues, so you can get in touch with them. But that's the most important thing, connecting you to the organization so you can access the information. And I just want to thank everyone for participating. This is recorded. So, once the partnership gets it, they'll make sure they make it accessible online. And with everyone that registered with your email, I'm sure we'll be able to communicate to you when that is available. As I close it out, I just want to thank everybody for being part of this discussion. I've learned a lot along the way. It's definitely made me realize how much more a partner we can be in this. And with that said, again, not to put everybody on the spot, but I hope we'll be doing this again somewhere in the 2024, so we can keep growing this discussion in this group, because I'm sure there's a lot of families that need this information. So with that said, everybody have a blessed night. Check out the information in the chat and look out for emails to keep you updated on what we're all doing.
Thank you. Good night, everybody.
Have a good night.
Thank you. Good night, everybody.
Good night.